Hello everyone, Namaste. I am Dr. Sounak Chabri. I am a consultant neurologist working in Manipal hospitals. And today I'll be talking to you about some important things about Alzheimer's and other dementias. And mostly the initial symptoms of dementia, how to identify those symptoms as a caregiver to the patients, and what should be done by the caregivers for the betterment of the patients. So, dementia, most commonly Alzheimer's, is a neurodegenerative disease. It is commonly a disease of the elderly. It means that it happens to the patients who are more than 65 years old. And it is not an acute disease that the symptoms appear suddenly or acutely. It's a gradual process. So, maximum times the symptoms gets overlooked by the caregiver or the family members of the patients. So, what is the initial symptoms that we encounter in Alzheimer's? The most common symptoms are the memory problems. In memory problems, what we see are the recent memory problems. Like the patient will forget what has he eaten in breakfast, or he or she will forget the banking password, ATM pin, like this. But most of the time, the remote and old memories, like the memories of the childhood, the memories of the youth, will be intact. The patient can recall those memories very well. And as the disease progresses, other symptoms appears, like there can be some behavioral changes. The patient can get a bit aggressive. The patient can also forget the known paths, like uh, the way to go to the local shop, or in between in the home also. It might happen the patient has forgot how to go to the washroom or go to the kitchen. So whenever these symptoms are appearing, we should the caregivers should identify these symptoms well in ahead, because why the early detection of the symptoms are most important, because all the medications we have available for the management of this dementia work well in the early phases. Whenever the disease has progressed to a certain extent, the role of the medications are limited. So if we can identify these symptoms well in ahead and then seek the medical care, we can give the patients the available treatments, and it will certainly slow down or even halt the progression of the diseases and maintain the patients in a functional state, so that they don't get totally dependent on the caregivers. And it is also very helpful for the caregivers to manage the patients in their home without any external help. So again, look forward to the patients and the memory symptoms they are having. If it is occurring, I will recommend you to consult a clinician about that, whether it's early symptoms of dementia or not, and then get the patient treated accordingly. Thank you.